Hello, everyone. A very warm welcome. And as you all know, Women in India it has turned 1 year now. And so to celebrate that, we are having a national conference, which is WinnieCon 2022. And for that, we are having this series of interviews of esteemed faculty all over the world. So I am Dr. Divya Vajpayee. I am Associate Professor in Nephrology at St. GS Medical College in KM Hospital. And also, I am the team leader of social media initiative of Win India. And with me today, I have Dr. Sylvie Shah, who is a world-renowned nephrologist, and she also happens to be a faculty at Winicon 2022. Dr. Sylvie Shah is an associate professor in the Division of Nephrology and Hypertension at University of Cincinnati, Ohio. She completed her nephrology fellowship from Cleveland Clinic Foundation, Ohio, followed by a transplant nephrology fellowship at University of Alabama in Birmingham. She's a physician scientist and she has done lots of research work on women's health in kidney diseases, including pregnancy, sex disparity in kidney disease, and kidney diseases in and kidney and cardiovascular diseases for women. She also has authored several peer-reviewed manuscripts and presented at various premier international and national meetings. She is an associate editor for Advances in Chronic Kidney Disease Journal and serves on the editorial board of Kidney 360 and Kidney Medicine Journal. She leads the American Society of Nephrology's Women's Health and Research in group and also is an executive member of American Society of Transplantations, Women's Health and Community Practice. So there can be no one better to interview today than Dr. Sylvie Shah. She also happens to be originally from India, from the city of Noida. So, Dr. Sylvie, we are really happy to have you here.
Thank you, Dr. Bajpai, for the wonderful introduction. And I'm so excited to be here. And again, congratulations to Win India for completing their 1 year. And it has been a tremendous success. And thank you for
Thank you.
having me.
Yeah, thank you, Sylvie. So, as you have been spearheading so many projects, what is really your passion? What drives you in nephrology?
So I think the reason nephrology, I think I find it very challenging. And so that's the first reason which drives me. It still involves a lot of thinking. It's every case is like a mystery, and we have to think and put the pieces together to solve it. So I think that is the first thing. And I think the second thing is it's very comprehensive. So I have always loved internal medicine, and I think as a subspecialty, nephrology was a perfect fit because, and even as a transplant, I'm a transplant physician as well. So basically, we see patients as whole, and we see them comprehensively. So those are the two things which drive me to nephrology.
Very true. So you will be speaking about cell-free DNA in transplantation at Winicon 2022. This is something which is very new for at least for us here in India. So please tell us something about the same, and do you have any experience about the same?
Yeah, so we have been frequently using cell-free DNA for our transplant patients, and I find it's one of the very innovative tools and technologies. It is a diagnostic test for a kidney injury and can help us rule in or rule out allograft rejection. So I've been using it for my patients. I think the first advantage is it's non-invasive. Of course, it's not like the gold standard, or it's not like confirmatory. You will need a kidney biopsy to make the final diagnosis, but at least it helps to rule kidney rejection. If it has a very high negative predictive value, so it helps us to rule out rejection. It helps us to screen patients when we are suspecting rejection, especially some patients who may refuse biopsy or who are at high risk for biopsies. It helps us to do surveillance after rejection treatment. So a lot of uses, and I have been frequently using it in my practice. And of course, I'll be talking more about it in my talk. But I've been very happy with it.
So is it available as a patient care test at your place, or is it still available for research activities only?
No, it's available. So there are two companies which have developed this test and are marketing it commercially. It's AlloSure and Natera. So it's available through patient care as a regular test. And we obviously have to make sure it's covered by their insurance. It's an expensive test, it's not cheap, so that's one of the disadvantage. But most of the test is either covered by insurance or they get absorbed by the transplant practice. But it's available. Like now we have it built in our actually lab system, so we can even directly order it through our electronic medical record. Just like a CBC, we can order it. Initially, we had to give patients the kits and fax and ship them, but now we can directly order it and they go to the lab and just get it there.
And what is the turnaround time approximately? Like you get the results in how much time?
So you get it within like 5 to 7 days. Sometime 3 to 5 days, you will get the results.
That is very interesting, actually. Moving ahead, you are passionate about obstetrics nephrology, and as you would know, you are here from India. Uh, Maternal mortality is still a major problem in developing countries. What are your what is your view about where do we lack and what we should do to improve the health of women, especially related to obstetrics and kidney
I,
diseases?
I think overall there's still a lot of awareness which needs to be done in this area, as we all talk about. Even as nephrologists, we are not comfortable in counseling women with kidney disease who have pregnancy or women's health. We don't talk about contraception. So I think that's one area of gap. The second area is like lack of multidisciplinary care, which again is very important. So all these pregnancies are high risk, and we have to make sure there is a high risk obstetrician and there is a neonatologist and of course a nephrologist as well who coordinate care. So I think that lack is there all over the world, to be very honest. And the third thing, which I feel is there's also this paternalistic attitude, and we have been talking about this very recently. I mean, more talking it openly in the recent times, like we as physicians feel like this is the perfect thing for them, but I think it's very important for us to involve women in shared decision making, because that is one of the reasons they get just lost to follow up or they will not see you, because having a child is again very important for them. So I think shared decision making again, incorporating that in our clinical practice would improve care of these women.
I completely as you have noticed, there are lots of young women who are now joining nephrology in India and also globally. So, what should be your advice to these early career young women like me? How do we move ahead in our career in nephrology?
So, I think the first thing is, and I'm very passionate about empowering movement and women in nephrology as well. So I've been like the past counselor for women in nephrology. So one of the things I feel is stay assertive. I think that's very important. All of you are very bright, and that's why you are here. Nephrology is a hard field, and it's not easy to get in. It's not easy to practice. So all of you are amazing. So I think be confident and assertive. I think that's very important. The second thing is look out for opportunities, actively ask for opportunities. That's what I tell everybody. So you may knock 5 doors, but one door will open for you. So don't be disappointed if some opportunity is not given to you, but seek out active opportunities. And I think the other thing is women suffer a lot from imposter syndrome. So I think knowing about that is important. And if you are given a task, don't be afraid to take it. You may not be 100% confident, or you may feel, well, I'm not perfect for it. But to be very honest, nobody is perfect for that. Once you start doing it, that's how you learn things and that's how you achieve perfection. And it's always also not important to be perfect at it. You have to be good at it, and fair at it. So I think take things which come your way, and don't be afraid to say yes to it. Yes.
Thank you so much, Sylvie. We had a wonderful time talking to you, and we will be waiting to hear you at Winicon 2022. I request all the audience to please join us. And Sylvie has a lot more to tell, and she'll be there at the conference joining virtually. So she'll be there during many of the sessions. So if there are more questions, they can be asked to her there. Thank you, Sylvie. Have a
Thank
nice
you.
day. Bye.
Thank you, Divya. Thanks for having me.
Thank you.